New data shows that the measles outbreak has now spread to 8 states, including Minnesota, with 100 people at least contracting the disease. The sole Minnesota case has been confirmed in a University of Minnesota student who had recently returned from international travel. The outbreak of the disease, once thought to be eradicated, has highlighted the battle over vaccines, which some groups continue to campaign against. Minnesota Department of Health data shows in some Minnesota schools there are large percentages of unvaccinated students. Joining us to talk about this is the Commissioner of the Department of Health, Ed Ehlinger. Dr. Ed Ehlinger, thank you so much for coming in.
Good morning, Esme.
And we did invite you here to talk about vaccines. I would be remiss, though, if I did not ask you about the pay raise controversy. You are one of the commissioners that Governor Dayton has appropriated a pay raise for. It takes your salary from $120,000 to $150,000. Dr. Ehlinger, your thoughts, your position on the pay raise?
Well, first of all, I'm really honored to be health commissioner, and I understood what the salary was when I accepted the job, but I got into healthcare to actually make a difference in the health of the people in this state, and this was an opportunity that I could not pass up. So being health commissioner is a real honor, and I would do it, you know, at the lower salary, and I certainly appreciate the governor's concern about our level of salary. I do know that I don't get to choose commissioners, but I get to choose other people within my organization. And I know it's been difficult to attract good people at a lower level, underneath the commissioner, because of the salary. And so because of the compression, because of the limitations on commissioner salary, it has had implications in hiring others within the agency.
All right, well, thank you for that. Let's talk about the issue of measles. The data that your department has collected shows that in some schools, you have 30% of kindergartners, some schools are even higher than that are not vaccinated. What risk does that pose for other children?
We know that measles is extremely contagious, and the more people who are unvaccinated increases the risk of the spread of disease. So if measles came into a community and there are a lot of unvaccinated folks, it's easier to transmit, and a school could really be affected by a large number of unvaccinated children.
And we've put all of your data, and we showed a little bit of that on camera right there. We've got links to that on our website so people can actually look up their school and see what percentage of kids are unvaccinated. If you've got 10% of kids who are not vaccinated in a school and your child is vaccinated, how much of a threat is that? Because the vaccine's only 95% effective if you get it.
Well, if you have 2 doses of the measles vaccine, it's about 99% effective. 1 dose is about 95% effective. You raise a good issue in a school when there are unvaccinated children that puts everybody at risk. And our job is to try to decrease the number of children who are not vaccinated. So we're trying to look at those exemptions of why people choose not to get their children vaccinated, address those so we can actually reduce that number, so we can get 99% of all children vaccinated, which would really decrease the risk overall.
All right. There are people who say, there are parents, there are celebrities who are out there saying, this caused a problem for my child. Is there any medical evidence at all to show there's a direct link between vaccines and various ailments?
Yeah. First of all, I want to make sure that people recognize that some of these other concerns, like autism, a significant issue, causes major concerns within families. And so we really need to look at the reasons for and the causes of autism. But have been shown, the data overwhelmingly show that there's no link between vaccinations and autism. And having celebrities make those kinds of claims feeds into a narrative that people want to hear, that they want to be able to blame something for a really disastrous kind of problem. So we're trying to break that link, and it's hard when celebrities say that there is a link. It is hard for us to break that because people hear what they want to hear. So our educational pieces are really about there's no link between immunizations, measles immunization, and autism.
Quickly, should there be legislation mandating vaccines? And there are a lot of exemptions that people can use.
Well, we do have laws that do mandate vaccines, and there are some exemptions that are there. Representative Freiberg has really introduced a bill that says if you're going to have an exemption, you need to go to your physician and get explained to you the risks of not getting vaccinated, the benefits of having vaccinated, and then having the physician sign off that you have had that kind of conversation.
You think that's a good idea?
I think that's a great idea.
Okay, well, Dr. Ehlinger, thank you so much for coming in.
Great to be here.
All right.